and start my lecture, which is a practical EUS examination of the pancreatic and biliary system, different stations and different landmarks. In my lecture, I will include the examination of the common bile duct and the gallbladder, the biliary system, and the whole pancreas. And the pancreas is a very large organ which contains many parts, which are the uncinate process and the pancreas, the rest of the pancreatic head and the pancreatic body, pancreatic tail, and the pancreatic duct, the main pancreatic duct or the dorsal pancreatic duct, and the papilla. Not only examination of the biliary system and the pancreas is important, but much more important to study the relation of the pancreas and biliary system to the surrounding structures, especially vascular structures, which is very important in staging of different pancreatic and biliary malignancies. So we should study the relation of the pancreas to the venous systemic veins like the inferior vena cava. We should study the relation of pancreatic masses to the arterial system, mainly the abdominal aorta and its very important branches like the celiac axis and its branches, left gastric, splenic and common hepatic, and also the superior mesenteric. We should study the relation with the portal venous circulation, mainly the splenic vein, superior mesenteric vein, and the portal vein. So there are many structures to study in this lecture. The pancreatic and biliary system and all these related surrounding structures, especially organs, and the vascular, venous, and arterial structures. So there are many structures, many ways crossing each other. So there should be a roadmap for studying all these structures, and there should be a landmark for each station. Actually, there are 4 stations during pancreatico-biliary examination by linear EUS. Station 1 is just below the papilla. Station 2 is at the level of the papilla. Station 3 is at the duodenal bulb. Station 4 is just below the cardia, gastric fundus, and actually body and antrum. So examination of the whole stomach is a station 4, and it is a very important station. As I will mention later, you can study the whole pancreato-biliary system from the stomach, including the distal CBD and the papilla. And of course, we should study or have a look on the liver and the mediastinum, because many of the malignant pancreatic and biliary lesions can metastasize to the liver and the mediastinum and mediastinal lymph nodes. So the presence of liver metastasis or mediastinal lymph node metastasis, which is a second and third station lymph node, in the presence of malignant pancreatic head, body, or tail masses, this will change totally the outcome. I will change totally the plan of management. We can start examination of the pancreatico-biliary system from station 1, just to go to the second part and below the papilla, and then withdraw the echo endoscope to go to stations 2, and then withdraw again to go to the bulb, and withdraw lastly to examine from the stomach. Some prefer to do the opposite. Some prefer to start studying the pancreas from below the cardia, and then go to the endoscopic picture and go to the bulb of the duodenum and study the pancreas from the bulb, and then go to the endoscopic picture again and go to the second part to study stations 1 and 2. Both methods are right, and I think the best method for examination is the way you are used to do and the way you are perfecting. I am used to study the pancreatico-biliary system from below upward. So I start with station 1 just below the papilla. Here I can examine the uncinate process from the duodenum. This is the echo endoscope and this is the papilla. I direct the echo endoscope just below the papilla, and I will do upward location of the echo endoscope. I withdraw the big wheel towards my body to do upward deflection. And here my landmark in station 1 is the large vascular structure, which is the abdominal aorta, and it appears here as a longitudinal structure, and maybe the inferior vena cava beside it. The part of the pancreatic tissue at this level is the uncinate process. So the uncinate process, I can locate it by putting the echo endoscope just below the papilla and upward deflection, and here I can locate my landmark, which is a longitudinal abdominal aorta, and here the pancreatic tissue at this level is the uncinate process of the pancreas. Uncinate process will be visualized also from the stomach, but here now we are visualizing it from the duodenum. So let us look at this short video. I am now just below the papilla. I will do upward deflection so I can locate the longitudinal abdominal aorta, and here this part of the pancreas at that level is the uncinate process of the pancreas. Uncinate process is very important because many tumors, especially ductal adenocarcinoma, may be located in the uncinate process. Let us withdraw the echo endoscope slightly upward to locate the echo endoscope at the level of the papilla, what we are known as kissing the papilla. Here the echo endoscope is at the level of the papilla, and the landmark here is the stack sign. Stack sign at the level of the papilla is two ducts, the common bile duct, which is the duct near to the echo endoscope, and the second duct away from the echo endoscope is the pancreatic duct. So this is the stack sign at the papillary region. This is the papillary region, and this is starting the head of the pancreas, and this is the common bile duct, and this is the pancreatic duct. Here we can see the abdominal aorta or the inferior vena cava, but it will appear as a circular structure because we release the upward deflection. So this is the stack sign at the region of the papilla, common bile duct near to the echo endoscope, and pancreatic duct is away from the echo endoscope. Let us see this short video. This is the abdominal aorta appearing as a circle, and this is the papillary region very nicely seen, and this is the common bile duct near to the lumen, and the pancreatic duct is away from the lumen. And this is the abdominal aorta, and here at the bottom of the screen is the superior mesenteric vein on the right side of the screen, and the superior mesenteric artery in the middle of the screen. So this is nicely seen papillary region. Station 2, abdominal aorta, lumen of the second part of the duodenum, papillary region, common bile duct near to the echo endoscope, and the pancreatic duct is away from the echo endoscope. And I can measure it carefully. The maximum diameter of the common bile duct, it should not exceed 7 or 8 millimeter. And the maximum diameter of the pancreatic duct in the region of the head is a maximum is 3 millimeter in the head region, 2 millimeter in the body region, and 1 millimeter in the tail region. Okay, then let us withdraw the echo endoscope more up to locate it in the upper second part of the duodenum. When I withdraw the echo endoscope up to be in the upper second part of the duodenum, I see a very famous view, a very nice view with a large area of the head of the pancreas. This is the head of the pancreas, and this is the inferior vena cava near to the echo endoscope, and the aorta away from the echo endoscope, and here this is the mesenteric vessels. So I can see the mesenteric vessels, superior mesenteric artery, superior mesenteric vein in the second part of the duodenum, while in the bulb I can see the confluence. So in the second part of the duodenum, I can see the superior mesenteric artery, superior mesenteric vein, and here a large part of the pancreatic head, and I can see here beautifully the common bile duct near to the echo endoscope, and here the pancreatic duct is away from the echo endoscope. So a very good observation that in the duodenum, the nearest structure to the echo endoscope is the common bile duct, and the farthest structure is the mesenteric vessels, mesenteric vein. And in between is the pancreatic duct. This is opposite to what we will find in the stomach. In the stomach, the nearest structure will be the superior mesenteric vein, and the farthest is the common bile duct. The opposite will occur in the stomach, but we are now in the duodenum, in the upper second part of the duodenum. So this is the echo endoscope inside the lumen. This is the inferior vena cava. This is the aorta. This is the superior mesenteric artery. This is the superior mesenteric vein. And here the common bile duct will be very near to the echo endoscope. And here the pancreatic duct will be located always between the superior mesenteric, between the common bile duct and the mesenteric vessels. Okay, this is a very nice view seen from the upper second part of the duodenum. Let us withdraw the echo endoscope a little bit to locate it in the bulb of the duodenum. Here the echo endoscope is located in the bulb of the duodenum. When you are in the bulb, just push it a little bit to engage the echo endoscope into the superior duodenal angle at the postbulbar region. Here my landmark is the venous confluence. The venous confluence is the meeting of the superior mesenteric vein coming from the right side of the screen and the splenic vein coming from the bottom of the screen to form the portal vein going to the left side of the screen and slightly up. This is my landmark. I should search for it. Now I am in the bulb of the duodenum, and I will do clockwise and anti-clockwise to locate the venous confluence. Yes, this is very nicely seen, my landmark. This is the superior mesenteric vein coming from the right side of the screen, splenic vein from the from below to form the portal vein. This is very important in different pancreatic head masses. This is very important to know the relation between the mass and this confluence. Then I will do clockwise and anti-clockwise. When I do clockwise rotation, yes, this is the confluence, I can see the common bile duct near to the echo endoscope because you are still in the duodenum, and the pancreatic duct is in between the common bile duct and the superior mesenteric artery and vein. So slide clockwise, I will see the superior mesenteric artery, pancreatic duct, and common bile duct near to the echo endoscope. More and more clockwise rotation, I can see the large vessels, aorta and inferior vena cava. So the aorta and inferior vena cava can be seen with clockwise rotation from the bulb on the duodenum. And more clockwise, but very gentle and slow to avoid perforation, I will see the right kidney and the part of the liver besides the right kidney, which is segment 6. But here, this is clockwise and anti-clockwise. I can see all the structure. This is the most clockwise, and then anti-clockwise, I can see the CBD and pancreatic duct. More and more anti-clockwise, I can see the venous confluence, and more anti-clockwise, I can see the gallbladder and the liver. So the examination of the bulb is very important. Locate the echo endoscope at the bulb, search for your landmark, which is the venous confluence, and start to do clockwise first, but slow and gentle. You will find the common bile duct and the pancreatic duct. More clockwise, you will find the major vessels, aorta and inferior vena cava. When you rotate the echo endoscope in the opposite direction, we will find from the aorta inferior vena cava, we will meet the ducts, CBD and pancreatic duct, and then more counterclockwise, you will see the confluence, and more counterclockwise, you can see the gallbladder from the duodenal bulb. Let us see this video. This is here the aorta and major vessels. Yes, here the pancreatic head. And this is, yes, this is the venous confluence here, and more anti-clockwise, I can see part of the liver. When I see part of the liver, I can do some downward deflection. The big wheel is away from my body, and then this will bring the gallbladder in the view. So the gallbladder can be seen by counterclockwise rotation in the bulb of the duodenum and slightly and slowly downward deflection of the big wheel. So I can see the gallbladder from the duodenum, and here the part of the liver at that level in the duodenum beside or deep to the gallbladder is segment 4, as we will mentioned in the lecture of segmental anatomy of the liver. Yes, this is the gallbladder, and gallbladder can be seen also from the prepyloric region, just before the pyloric ring. So the gallbladder can be seen just before and just after the pyloric ring. Can be seen in the prepyloric area and the bulb of the duodenum. Here I should, the echo endoscope should face 9 o'clock. So I will do also anti-clockwise. So anti-clockwise from the bulb of the duodenum and anti-clockwise from the prepyloric region can bring the gallbladder into the view. And here this is a stone inside the gallbladder, and I think this is some minute cholesterol polypi. Then we'll go to the second half of the lecture, which is very important, to the station 4 examination from the stomach, which in this station we can visualize the whole pancreas, including its head and even the papillary region. Not so clear like in the duodenum. Duodenum, it will be very clear, but I can see it. I can see large masses from the papilla by examination from the stomach. So let us start examination from the stomach or station 4. I start just below the cardia, and I can find the left crus of the diaphragm, which is a thin fleshy part in front of the aorta. When I push the echo endoscope further downwards inside the patient, I can see the first big branch of the aorta, which is the celiac axis, and the second one, which is the superior mesenteric artery. And if there is a large third one, then it will be the left renal artery. Then let us see this video. When I locate the major vessels of the aorta just below the cardia, I should do clockwise rotation to go to the body and the tail of the pancreas and the left kidney, left suprarenal, and the spleen, and then back to the aorta and do anti-clockwise rotation to see the head and the uncinate process of the pancreas. So at this level, yes, I am now at the cardia, and this is nicely seen the aorta, and this is the first branch, which is the celiac axis, and this is the second branch, superior mesenteric, and this is the left renal. Here at this level, sorry, here at this level, I can see the splenic vessel. So this is the aorta, celiac axis, and here this is the splenic vessels. So this is the celiac axis, and this is the splenic artery and splenic vein. The part of the pancreas at this level is the pancreatic starting of the pancreatic body. The pancreatic body is at the level of splenic artery and splenic vein. So this is the celiac axis, superior mesenteric artery, splenic artery, and splenic vein. I will bring the splenic vessels in the middle of the screen and then start to do clockwise rotation. Clockwise rotation. So this is the pancreatic body, and with more and more clockwise rotation, I can see the left kidney. So this is the pancreatic body, the part of the pancreas at the level of the splenic vessels and the left kidney. So this is the region of the pancreatic body, and here more and more clockwise rotation, and I can see the spleen. So clockwise, clockwise, clockwise rotation. Yes, this is the left kidney, very nice. And here, this is the spleen by clockwise rotation. The part of the pancreas at the level of the spleen and the left kidney is the pancreatic tail. So the pancreatic tail is at the level of the spleen, the pancreatic body at the level of the left kidney, and here I can see the left suprarenal gland at the upper pool of the left kidney. Yes, this is very nicely seen suprarenal gland. It is like a seagull. The seagull bird is a bird which has a small body and two long wings. This is one of the seagulls of the abdomen. There are many seagulls, vascular, venous, and arterial, which we'll mention later. So by clockwise rotation, we can visualize the pancreatic body and tail, left suprarenal, left kidney, and the spleen. We will go back to the aorta just below the cardia and the origin of the major vessel, celiac and superior mesenteric, and start to do counter-clockwise or anti-clockwise or left deflection of the echo endoscope. So first, sorry. So first, we locate the aorta, celiac axis, superior mesenteric artery, and here this is the splenic vessels, and this is the pancreatic body. We concentrate on the splenic vein. This is the splenic artery, up and right to the screen, and splenic vein slightly to the left and in a level just below the level of the splenic artery. So this is the splenic artery, splenic vein. I will trace the splenic vein by doing anti-clockwise rotation, very gentle anti-clockwise rotation. We can see the venous confluence here. Very nicely seen, venous confluence. Yes, this is the splenic vein, and this is the superior mesenteric vein. This is the superior mesenteric vein, and here will be the portal vein going to the porta hepatis and the liver hilum. This is the region of the pancreatic head, and at the confluence, the region of the pancreatic neck, and at the region of the splenic vessels, this is the pancreatic body, and at the spleen, the level of the pancreatic tail. Here, this is the superior mesenteric vein, so this is the region of the pancreatic head seen from the stomach. As I mentioned before, from the stomach, the nearest structure to the echo endoscope is the superior mesenteric vein. And the most far or the farthest structure is the common bile duct. Opposite to that, we found in the duodenum. Here the common bile duct, here the superior mesenteric vein, and the pancreatic duct will be in between, going to the papilla to unite with the common bile duct as the region of the papilla. So let us go. Yes, this is the common bile duct, very nicely seen. This is the venous confluence and the superior mesenteric vein. This is the common bile duct, very nicely seen. It is away from the echo endoscope. It is a normal diameter of the common bile duct. Expecting here to find the pancreatic duct. Yes, this very thin duct is the pancreatic duct. Yes, and uniting with the common bile duct as the region of the papilla. So this is the region of the papilla. This is the air inside the second part of the duodenum. This is the common bile duct, the most distal part at the papilla and the most proximal part at the porta hepatis. And this is the pancreatic duct uniting with the common bile duct. And here, this is the superior mesenteric vein. So this is a big part or the most part of the pancreatic head region. So we can see the common bile duct, including its distal part, papillary region, and the whole pancreatic head from examination from the stomach. And this will be very important in every case, and especially in cases of gastric outlet obstruction. Tamam. This some pathology, some very nice pathology, demonstrating how you can see the common bile duct from the stomach. This is the superior mesenteric vein, and this is the portal vein going to the liver. And here, this is the common bile duct. No color inside, but it is much dilated because there is obstructive jaundice. So this is the superior mesenteric vein, and this is the common bile duct. It is dilated. Why it is dilated? Why it is dilated? We can do some manipulations, some pushing, some pulling, very slow clock and anti-clockwise. You can see a large stone inside the mid portion of the common bile duct. Here is the papilla, and here is the mid portion of the common bile duct, and this is the liver, and this is the most proximal part of the common bile duct. It is a very large stone. It is about 14 or 15 millimeter, 1.5 centimeter. And this is a very nice case of a very large stone, but in the distal most part of the common bile duct. You see, this is the common bile duct is markedly dilated, no color flow signal inside. And this is a large stone impacted as the region of the papilla. And this is the duodenum and the air inside the second part of the duodenum. So it is a very large stone in the common bile duct seen from the stomach. And this is a very nice case of a somewhat large papillary or ampullary mass, proved later on after surgery to be gastrointestinal stromal cell tumor of the papilla, which is not common. This is the view from the duodenum. Yes, This is the view from the duodenum. This is a papillary mass from the duodenum. And here, this is the papillary mass from the stomach. This is the common bile duct collapsed over a plastic stent. Yes, this is the common bile duct with a stent inside. And this is the superior mesenteric vein. Yes. And at the most distal part of the common bile duct, this is the papillary region. And this is the second part of the duodenum. Here, the papillary region. There is a mass inside the papillary region, a large mass. It was about 3 point something, between 2 and 3 centimeter. And here, Whipple operation was done and finally proved to gastrointestinal stromal cell tumor. So I can see the mass very nicely because it is a rather large mass from the examination from the stomach. So a very well seen papillary mass here from the stomach and there from the duodenum. This is a well placed stent inside the common bile duct, the farthest structure from the echoendoscope, and this is the superior mesenteric vein. And this case was published in the gastrointestinal endoscopy. It adds the section of at the focal point. How can we beautifully demonstrate papillary masses from examination from the stomach? Now we are come to the last two videos of my lecture, a very nice, but I think very important lectures, how to examine the vasculature from the stomach, which is very important in staging of pancreatic body and head malignancy. This is the aorta, and this is the celiac axis. This is the superior mesenteric artery, and this is the left renal, and this is the splenic vein. Here, this is the celiac axis. I can trace its branches. The first branch is the left gastric going to the right of the screen, and the splenic going to the left side of the screen. This is the right side of the screen, left gastric, left side of the screen, splenic artery, and left gastric artery. And this is one of the seagull, of the vascular seagull of the bird, with a body which is the celiac axis and two long wings, which is the left gastric artery and the splenic artery. If I do counterclockwise rotation in this view, I can trace the third and the most important artery, which is the common hepatic artery. Here, the common hepatic artery will go down and will divide finally into two large branches. Hepatic artery proper going to the porta hepatis to accompany the portal vein, and the gastroduodenal artery going to the head of the pancreas. So this is the common hepatic artery, yes, going down, and finally will give rise to the hepatic artery proper going to the liver, and the gastroduodenal artery, yes, gastroduodenal artery going to the left of the side of the screen to the head of the pancreas. And at the end, I can push the echoendoscope slightly from that level, and I can see beautifully the superior mesenteric artery, a large part of the superior mesenteric artery and the superior mesenteric vein, and the pancreatic tissue in between the mesenteric vessels above and the aorta below is the uncinate process of the pancreas. So the uncinate process of the pancreas can be seen from the stomach. We saw it from the station 1 just below the papilla and the duodenum, and here from the stomach. So at the end, what I'd like to say that we can see all the pancreatico-biliary system from the stomach, the uncinate process, the head of the pancreas, the papilla, the whole length of the common bile duct, including its distal part, the pancreatic duct, including its meeting at the papilla with the common bile duct, and the pancreatic body at the level of the splenic vessels, and at the level of the left renal, left kidney, and then the pancreatic tail at the level of the spleen and the left kidney. So I came now to the end of my lecture, and my take-home messages are: there are 4 main stations seen from the stomach and the duodenum, in addition to the mediastinum, through the esophagus and also the liver. You can start from below upwards, starting from station 1 to 4, or the opposite. I think the best way of EUS examination is the way you are used to do and the way you are perfecting. However, from above, below, or below, above, in each station, try to identify your landmark. And thanks for your attention.